Welcome back to Medik Talk, where we like to take complex medical topics and make them easy to understand and remember.
Absolutely. And today we're going to be tackling a big one.
Yeah, a really big one.
Yeah.
Type 2 diabetes, or T2DM.
Uh,
As always, we're going to try to cover as much ground as possible, so buckle up.
It's a condition that affects millions around the world.
And it's a major focus in healthcare.
And it's one of those conditions that every healthcare professional will encounter in their practice.
So whether you're a student nurse, a med student, or even a seasoned clinician, this deep dive is going to equip you with a solid understanding of T2DM.
It's crucial for anyone going into medicine to have a solid grasp of T2DM, not just the facts, but also the underlying mechanisms.
You're absolutely right. We need to move beyond rote memorization and really understand what's happening at the cellular level.
Exactly.
So we're going to break it down step by step, starting with the basics. How does insulin work in a healthy body?
Okay. So think of insulin as a key that unlocks the doors of your cells to let glucose in.
Okay, I like that analogy.
Yeah.
It's simple but effective.
Glucose is the sugar from the food you eat, and it's the primary source of energy for your body.
So the pancreas is like the key maker, churning out insulin to unlock those cell doors and let the glucose fuel our bodies.
Exactly. And just like certain rooms in a house are used more than others, the liver and skeletal muscles are particularly important when it comes to glucose uptake.
So they're like the high traffic areas where glucose is in high demand.
Exactly.
Okay, so now let's talk about where things go wrong in type 2 diabetes. What is insulin resistance and how does it develop?
Imagine constantly bombarding your cells with sugar, from sugary drinks, processed foods, you name it. Over time, this can lead to chronically high insulin levels, and your cells start to become desensitized.
So it's like they're getting tired of being told to open up for all that sugar.
Right. They become resistant to insulin's effects, needing more and more insulin to take in the same amount of glucose.
And that's the core of insulin resistance.
That's it.
Now, I remember learning about the pancreas getting exhausted in T2DM. How does that fit into this picture?
That's a crucial point. Initially, the pancreas tries to compensate for this resistance by producing more insulin. It's like yelling louder for someone to open the door when they're ignoring you.
But eventually, the pancreas just can't keep up.
Exactly. It gets tired, worn out, and can't keep up, leading to insulin deficiency.
It's almost like a domino effect, starting with that constant sugar overload. And this is completely different from type 1 diabetes, right?
Absolutely. In type 1 diabetes, the body's immune system mistakenly attacks the insulin-producing cells in the pancreas, so there's no insulin from the get-go.
It's like the key maker is out of commission.
Right.
So now that we understand what's happening at the cellular level, let's talk about who's at risk of developing T2DM. We know family history plays a role, but what does that actually mean for an individual?
It means that if you have a first-degree relative, a parent or sibling with T2DM, your risk goes up significantly.
It's a good reminder to know your family medical history because that's something you can't change.
Exactly.
But what about the factors we can control? I know obesity is a big one.
Absolutely. Obesity is a major player. And it all ties back to that insulin resistance we talked about. When you carry excess weight, especially around the abdomen, it can interfere with how your cells respond to insulin.
So even a little weight loss could make a big difference.
Even losing 5–10% of your body weight can have a significant impact on insulin sensitivity.
That's encouraging. It's not a life sentence.
Right.
Are there any other modifiable risk factors we should be aware of?
There are several. Excessive alcohol consumption can damage the pancreas, impairing its ability to produce insulin.
So that's something to keep in mind.
And smoking also increases insulin resistance and contributes to other health problems that can worsen T2DM.
Okay, so that's another one to avoid.
Yeah, and we can't forget about stress. Chronic stress triggers the release of hormones like cortisol, which can increase insulin resistance.
Oh, that's interesting. So it's not just about what we eat and drink, but also how we manage stress.
Exactly. It's all connected.
Wow. It's amazing how interconnected everything is. You wouldn't think stress and sleep deprivation could have such a big impact on a condition like diabetes.
It's all about that delicate balance within our bodies.
Right. And speaking of interconnectedness, are there specific conditions that can increase your risk of developing T2DM?
Yes, there are. For example, PCOS, or polycystic ovary syndrome, increases the risk.
Okay, I've heard of PCOS, but why does it increase the risk of T2DM?
Women with PCOS often have insulin resistance even if they don't have diabetes. It's thought to be related to hormonal imbalances.
So it's another piece of that complex puzzle.
Yeah.
Are there any other conditions we should be mindful of?
Gestational diabetes, which develops during pregnancy, also increases the lifetime risk of developing T2DM.
Ah, so that's something to consider for women who've had gestational diabetes.
And certain medications like steroids and some antipsychotics can also contribute to insulin resistance.
Okay, that's a lot of information to process.
Hmm.
But it's fascinating how all these different factors come together.
Hmm.
It's a reminder that a person's medical history is so important.
It is. It's like putting together a puzzle to understand an individual's risk.
Right. But let's move on to symptoms. How can you tell if you actually have T2DM? What are the telltale signs?
This is where things get a bit tricky because T2DM can be quite sneaky.
Oh, no.
Many people don't experience noticeable symptoms in the early stages, and it's often picked up during routine checkups or even after a complication has already developed.
That's concerning. So what should people be looking out for? What are some of the red flags?
We often think of the classic triad of symptoms: frequent urination, excessive thirst, and unintentional weight loss.
Right. I remember learning about those.
But those are actually more common in type 1 diabetes. However, if you're experiencing any of those, it's definitely worth getting checked out.
Okay. So what are some symptoms that are more specific to T2DM?
Feeling tired all the time, or TATT as it's sometimes called, is a common complaint.
I can see how that might be easily dismissed or attributed to other things, especially with our busy lifestyles.
Yeah. And while it can be caused by many things in the context of T2DM, it's often because your cells aren't getting the energy they need from glucose efficiently.
Are there any other signs people should watch out for?
Frequent or recurring infections, especially urinary tract infections and thrush, can be a red flag.
Ah, so high blood sugar can make you more susceptible to infections.
Exactly. High blood sugar creates an environment where those infections can thrive.
Okay, so if you're getting more infections than usual, it might be a sign to get your blood sugar checked.
Yeah. And then there are some symptoms that are actually signs of complications already developing.
Oh, like what?
Things like slow healing wounds, blurred vision, or tingling and numbness in your hands and feet.
So it can affect your whole body. It sounds like early detection is crucial.
Absolutely. That's why routine checkups and being aware of your risk factors are so important. The earlier you catch it, the better you can manage it and prevent those complications from developing.
Right. That makes sense. So speaking of early detection, how is T2DM actually diagnosed? I've heard of a test called HbA1c. What exactly is that?
Ah, yes, HbA1c. Think of it as a blood sugar detective.
Okay, I like it. A blood sugar detective. What does it do?
It's the primary test used to diagnose and monitor T2DM.
So it's a key player in the diagnostic process.
It is.
I'm intrigued. How does this blood sugar detective actually work?
It's pretty clever. HbA1c measures your average blood glucose levels over the past 2 to 3 months.
Ah, so it gives you a bigger picture of what's been going on.
Exactly. And it does this by looking at glucose that's attached to hemoglobin, the protein in red blood cells that carries oxygen throughout your body.
So it's like a long-term record of your blood sugar, not just a snapshot from a single point in time.
That's right. And since red blood cells have a lifespan of about 120 days, it gives us a good overall picture of your blood sugar control.
Okay, that makes sense. So what are the magic numbers we need to know? What's considered normal versus pre-diabetic versus a T2DM diagnosis?
A normal HbA1c is below 42 millimonomol.
Okay, 42.
Prediabetes is diagnosed when your HbA1c falls between 42 and 47 millimole.
So that's that gray area where you're not quite diabetic, but you're at increased risk.
Exactly. And a diagnosis of T2DM is made if your HbA1c is 48 millimole or higher.
Okay, so 48 is the threshold for a diabetes diagnosis.
Yeah.
So if someone has symptoms and a single high HbA1c reading, that's enough for a diagnosis.
Got it. But if someone doesn't have symptoms and their HbA1c is high, we usually repeat the test in a couple of weeks to confirm the diagnosis.
It makes sense to be sure. Are there any other tests used to diagnose T2DM?
There are other blood tests like fasting plasma glucose and random plasma glucose.
Okay, so those are looking at your blood sugar levels at a specific point in time.
Right, but HbA1c is generally preferred because it provides that long-term picture and isn't affected by what you've recently eaten.
Right, it's more reliable in that sense.
Right.
Now, you mentioned a few other tests earlier, liver function tests, cholesterol panels, and something about urine. Are those just routine checks, or are they specifically related to T2DM?
They're definitely relevant in the context of T2DM.
Okay, so they help us understand the bigger picture.
Exactly. For example, liver function tests are important because fatty liver disease, a condition often linked to insulin resistance and metabolic syndrome, can affect how certain diabetes medications work.
Ah, So it's about understanding how different conditions might interact.
Precisely. And cholesterol is another key player.
Right, because high cholesterol is a risk factor for cardiovascular disease.
Exactly. And that other test I mentioned, the urine albumin creatinine ratio, or UACR, helps us detect early signs of kidney damage, which can be a complication of T2DM.
So it's like all these tests are pieces of a puzzle, helping us paint a complete picture of someone's health and guide their management plan.
That's a great way to put it. It's about connecting the dots and understanding the interplay between different systems in the body.
Right. So we've covered a lot of ground here, from how insulin works to the risk factors and even how T2DM is diagnosed.
Yeah, we have.
Now let's move on to the crucial part. How do we actually manage this condition?
That's where it gets really interesting.
Let's dive into that in the next part of our deep dive.
So when we talk about managing type 2 diabetes, it really boils down to a two-pronged approach.
Okay, I'm all ears. What are those two prongs?
We have lifestyle modifications, which are the foundation. This is where we empower individuals to take control of their health. And then if needed, the second prong is medications, which can provide that extra support to keep blood sugar levels in check.
So it's kind of like a 1-2 punch.
You could say that.
You lay the groundwork with lifestyle changes, and then if you need more firepower, you bring in the medications.
That's a good way to think about it. And remember how we talked about the impact of weight loss earlier?
Yeah, even a small amount can make a difference.
Exactly. Even losing 5–10% of your body weight can significantly improve insulin sensitivity, and in some cases may even lead to remission.
Wow, remission. That's incredible. So it's not always a chronic condition?
Not necessarily. For some people, making those lifestyle changes can actually reverse the condition.
That's incredibly encouraging. So when we talk about lifestyle modifications, where should people focus their efforts?
Diet is absolutely crucial. We need to break free from the cycle of constantly bombarding our bodies with sugar, especially from processed foods and refined carbohydrates.
So those are the main culprits behind insulin resistance.
They are. They're the things that really throw our blood sugar out of whack.
So what would a T2DM-friendly diet look like? What kind of swaps should people be making?
Think about filling your plate with colorful vegetables, lean protein sources like fish or chicken, and healthy fats from nuts and seeds. Swap out white bread and pasta for whole grain alternatives, and ditch those sugary drinks for water or unsweetened tea.
It sounds like a complete dietary overhaul focusing on whole unprocessed foods. I've also heard about low-calorie diets being used for T2DM. How do those fit in?
Low-calorie diets, typically ranging from 800 to 1,500 calories per day, have shown remarkable results for rapid weight loss and even T2DM reversal. They work by drastically reducing calorie intake, giving the body a chance to reset and improve insulin sensitivity.
So it's like hitting the reset button on your metabolism.
Okay. You got it. And the NHS even has a program, the Type 2 Diabetes Path to Remission program, which incorporates a low-calorie diet as a key component.
That's fantastic. It's truly empowering to know that remission is a real possibility for some people. But what about exercise? How does that factor into managing T2DM?
Exercise is another powerful tool. When you engage in physical activity, your muscles actually take up glucose from the bloodstream without needing insulin.
So it's like a natural way to lower your blood sugar.
Exactly. And it has all sorts of other benefits for your overall health.
What type of exercise is best for people with T2DM?
Any type of movement is beneficial, but building muscle mass is particularly helpful because muscle tissue is more metabolically active and helps regulate blood sugar levels more effectively.
So a combination of cardio and strength training would be ideal.
You got it. Aim for at least 150 minutes of moderate intensity aerobic activity like brisk walking or cycling per week, and try to incorporate strength training exercises that work all the major muscle groups at least twice a week.
Okay, so we've got diet and exercise covered. Are there any other lifestyle factors that can make a difference in managing T2DM?
Absolutely. Reducing alcohol intake is crucial. Excessive alcohol can damage the pancreas and interfere with blood sugar control. And we can't forget about smoking. It increases insulin resistance and worsens other health issues related to T2DM.
It sounds like creating a healthy lifestyle is a holistic endeavor. It's not just about changing one or two things. It's about making overall positive choices.
Exactly. It's about making sustainable changes that become part of your daily routine, not just temporary fixes.
So we've built a solid foundation with lifestyle changes. But what happens when that's not enough to manage blood sugar levels?
That's where medications come in.
Right, because sometimes you need a little extra help.
Exactly. And there's quite a variety of medications available for T2DM. It can seem a bit overwhelming at first.
It can.
Yeah,
There are so many different options.
there are, but it's not as complicated as it seems. Each medication works in a slightly different way, but they all aim to improve blood sugar control.
Okay, so let's break it down. What's typically the first medication prescribed for someone with T2DM?
The go-to first-line medication is usually metformin. Think of it as a multitasker.
A multitask. Okay, tell me more.
It reduces insulin resistance in your cells, making them more responsive to insulin, and it also lowers the amount of glucose produced by the liver.
Wow. So it tackles the problem from multiple angles.
It does. And it's been around for a long time, so we have a lot of data on its safety and effectiveness.
That's reassuring. What other options are there if metformin isn't suitable or doesn't provide sufficient control?
There's a newer class of drugs called SGLT2 inhibitors.
Okay, I've heard of those. They're the ones that make you pee out sugar, right?
That's right. They increase glucose excretion through your urine, so your body basically flushes out excess sugar.
That's pretty amazing. What are the advantages of using SGLT2 inhibitors over other medications?
Well, besides helping lower blood sugar, they've also been shown to have cardiovascular benefits. They can reduce the risk of heart attack, stroke, and heart failure in people with T2DM.
That's a significant bonus. Are there any downsides to using them?
Like all medications, they can have side effects. The most common ones with SGLT2 inhibitors are urinary tract infections and genital yeast infections.
Okay, so it's important to be aware of those potential side effects. What other types of medications are commonly used for T2DM?
We also have sulfonylureas, which are older drugs that stimulate the pancreas to release more insulin.
So they give the pancreas a little boost.
Exactly. They work well for people who still have some pancreatic function.
What other options are there?
Then there are DPP-4 inhibitors and GLP-1 receptor agonists. These medications work by mimicking the action of gut hormones that help regulate blood sugar.
So they're like reinforcements for your body's natural blood sugar regulators.
That's a good way to put it. And they often come with additional benefits like weight loss and reduced cardiovascular risk.
It's amazing how many different approaches there are to managing TTDM. It really highlights the importance of personalized treatment plans.
You're absolutely right. There's no one-size-fits-all approach. The choice of medication depends on various factors like the individual's health status, other conditions they might have, and even their preferences.
It sounds like a collaborative process between the healthcare provider and the individual to find the best treatment strategy.
It is. It's all about working together to achieve the best possible outcomes.
But I'm curious, why is it so crucial to manage T2DM effectively in the first place? What are the consequences if it's not well controlled?
That's an incredibly important question. Uncontrolled T2DM can lead to a whole cascade of complications, and those complications can be quite serious.
Okay, so let's delve into that. What are the potential consequences of poorly managed T2DM?
Well, it all boils down to the damaging effects of high blood sugar on blood vessels throughout the body. Over time, this can lead to problems in various organs and systems.
So it's not just about blood sugar levels, it's about the long-term impact on overall health.
Exactly. It's about preventing the domino effect of complications that can arise from sustained high blood sugar.
This is where it gets really important. So let's unpack these complications in more detail. What are some of the key things people should be aware of?
Think of your blood vessels as like a network of pipes carrying those vital nutrients and oxygen throughout your body. When blood sugar levels are consistently high, it's like sand flowing through those pipes, causing wear and tear over time.
So it's not just about the immediate effects of high blood sugar, it's about the long-term consequences for your entire vascular system.
Precisely. And that damage can manifest in different ways. We often categorize the complications as macrovascular and microvascular, depending on whether larger or smaller blood vessels are affected.
Okay, let's unpack those categories, starting with macrovascular complications. What are the risks associated with damage to those larger blood vessels?
When larger blood vessels are damaged, it significantly increases the risk of developing cardiovascular disease.
So heart problems.
Right. This means you're more likely to experience heart attacks, strokes, and even peripheral artery disease, which can affect blood flow to your limbs.
And in severe cases, that can even lead to amputation.
You got it.
So essentially, high blood sugar is setting the stage for potential heart problems and circulation issues down the line.
That's a good way to put it.
Yeah.
And unfortunately, it doesn't stop there. Let's move on to microvascular complications, which involve those tiny blood vessels supplying vital organs.
Okay, so what are the implications of damage to these smaller vessels?
Think of it like this. If the pipes supplying water to your house are damaged, it can lead to problems in specific rooms.
Right, like a leaky faucet in the bathroom.
Exactly. Similarly, damage to small blood vessels can disrupt the function of specific organs.
So it's like miniature plumbing problems, but with potentially big consequences for those organs.
Precisely. Let's start with the kidneys.
Okay, the kidneys are essential for filtering waste products from the blood.
Right. High blood sugar can damage those delicate filtering units in the kidneys, leading to a condition called diabetic nephropathy.
And what are the long-term implications of diabetic nephropathy if it's not managed?
Over time, it can progress to chronic kidney disease, which means your kidneys are no longer able to effectively filter waste products. This can lead to a buildup of toxins in your body and may eventually require dialysis or even a kidney transplant.
That sounds incredibly serious.
Mm.
It's a stark reminder of how important it is to manage those blood sugar levels.
It is, and the damage doesn't stop at the kidneys. High blood sugar can also affect the tiny blood vessels in your eyes, leading to a condition called diabetic retinopathy.
I've heard about that. It can affect your vision, right?
That's right. The retina is the light-sensitive tissue at the back of your eye that allows you to see.
So when those blood vessels in the retina are damaged, what happens?
They can start to leak fluid or bleed, and this can distort your vision and, in severe cases, lead to blindness.
That's a frightening thought. It's incredible how something as seemingly simple as high blood sugar can have such a profound impact on your vision.
It really underscores the interconnectedness of our bodies. And there's another major microvascular complication we need to talk about, diabetic neuropathy.
I know that involves nerve damage. What are the typical symptoms people experience?
Diabetic neuropathy usually affects the nerves in the hands and feet first, causing symptoms like pain, numbness, tingling, and even loss of sensation.
So it can affect both the sensory and motor nerves in the extremities.
Exactly. And this can lead to problems with balance coordination and even wound healing. Because if you can't feel a cut or a sore on your foot, you might not notice it, and it could become infected.
That's a really important point.
Right.
It highlights the importance of regular foot checks for people with diabetes.
Absolutely. And those are just the most common complications. There are others less directly related to blood vessel damage, but still associated with T2DM.
Like what?
Things like Charcot's foot, which is a deformity of the foot joint's frozen shoulder, and carpal tunnel syndrome.
Wow. Sounds like uncontrolled T2DM can have far-reaching consequences for nearly every system in the body.
It really can. But while it can feel overwhelming, it's important to remember that we have the tools and knowledge to effectively manage T2DM and significantly reduce the risk of these complications.
That's a message of hope. It's not a hopeless situation.
Not at all.
So to wrap up our deep dive into type 2 diabetes, we started by exploring the underlying mechanism insulin resistance and how it develops. Then we delved into the various risk factors, both those we can and can't control.
And we discussed the importance of early detection and diagnosis, highlighting the role of the HbA1c test, as well as other relevant investigations.
We then moved on to the crucial aspect of management, emphasizing the two-pronged approach of lifestyle modifications and medications, tailoring treatment plans to individual needs.
And finally, we discussed the potential complications of poorly managed T2DM, emphasizing the importance of proactive management to prevent those long-term consequences.
It's been a comprehensive journey through the world of type 2 diabetes. We've covered a lot of ground.
We have.
But the key takeaway is that while this is a complex condition with potentially serious complications, it's also a condition that can be effectively managed with the right knowledge and support. So to our listeners out there, we encourage you to keep learning. Talk to your healthcare providers, ask questions, and be active participants in your own health journey. Small changes can make a big difference, and it's never too late to take control. Until next time on Medik Talk, stay curious, stay informed, and stay healthy.